The Delhi COVID crisis, ladies and gentlemen, has just gone through the roof. And how? The highest ever single-day spike of cases in the national capital, 17,282 cases. Let that number sink in for a second. 17,282 cases. 104 people have died just in the last 24 hours. The positivity rate is almost 16%. About a month back, that was less than 1%. Now, 16 out of 100 people in Delhi are testing positive. Active cases stand at over 50,000 in the national capital. Rupashri Nanda is joining us. Rupashri, this is absolutely mind-boggling, the rate at which this disease is spreading in Delhi.
Absolutely, Zakka. In fact, it is extremely alarming. And for the past 4 consecutive days, Delhi has, breached its peaks. And this also is the highest single-day spike reported and the highest, numbers of cases between 2 consecutive days. Yesterday, Delhi positivity rate was about 13%, and today it is nearly 16%. That is a 3% jump, which has never been seen before. And therefore, the numbers are extremely, grim. And look at the casualties, 104 casualties. That is more than 4 deaths per day in the capital. And just a few days back, in the beginning of, end of March, it was less than 10 deaths per day. So the casualties are also shooting up very high and in a very rapid fashion. They've gone from 48 to 72 to 81 and now 104 in the past 4 days alone. And therefore, the situation is not good at all. Look at the active number of cases. I mean, Delhi has never had so many, active cases. It has reached the 50,000 mark. And if this is the rate at which cases continue to surge, then definitely it is a cause for, an emergency situation in the capital. We are really staring at something that is very grim and that could really go out of control unless something is done immediately to rein it in.
All right, we'll leave it at that. We'll see what those steps are. Clearly, the Delhi government will be paying attention to these numbers. These numbers have suddenly hit everyone in the face in a way that will hopefully wake us all up to the reality and the deepness of this problem, just how grave this problem is. These numbers are indeed staggering, 17,282 cases. Let's shift focus because we've been talking about Mumbai, and finally, after all these days, Maharashtra and Mumbai go into day 1 of what's being called Janata Curfew for the next 15 days. It's going to be in effect till 7 a.m. on the 1st of May. It started at 8 p.m. Tonight. Now, workplaces, hotels, eateries across the state have to stay closed. Night curfews are in place from 8 p.m. to 8 a.m. Essential services, including hospitals, pharmacies, vaccination centers, grocery stores, and home delivery services, along with public transport, will continue to operate. The curfew comes even as the state government's health infrastructure is under such severe stress with a shortage of beds and a major crunch in oxygen supply. Let's get a status check of what's going on in Mumbai. Zeba Warsi is joining us from Malad and Mihit Trivedi is joining us from Kandivli. Zeba, first to you, what's the situation? Are people following the Janata Curfew? I see a lot of activity behind you.
Well, I am at Marve Road, Zakka. This is one of the most buzzing places in Malad in suburban Mumbai. And the road is buzzing with vehicles. Perhaps people trying to get back home, considering that the curfew has already kicked in. The curfew is already officially imposed in the state of Maharashtra and in Mumbai. It's been over an hour. But I don't see any enforcement of it on the ground. Yes, there are non-essential shops that have now put down their shutters. So that has happened, and that has happened in the last 30 minutes or so in front of me. But vehicles still plying on the road, BEST buses still plying on the road, auto rickshaws still plying on the road, people still walking along. So this is a situation at around 9:02 p.m. On a day when Maharashtra enters a 15-day long curfew. So clearly there needs to be more enforcement on the ground. Perhaps by tomorrow we will see people truly obeying it. But as of now, people are still trying to get back home, and there is quite an evening traffic rush on the streets of Mumbai, here in suburban Mumbai.
Quick word from Mihir Trivedi as well. He's in Kandivali, also in the outskirts. What's the situation there? Are people milling around? Because there it seems, at least in your background, it seems a little quieter.
Absolutely. This place at 9 p.m. is buzzing with activity, but that's not the case today. It's quieter than it seems on a general day. That is because people know that there is a Janata Curfew that's in place. Having said that, there are certain non-essential shops that are discreetly open with half shutters down. What is critical at this point is also I have not seen one police patrolling van moving around or trying to get a stock of the situation. Now there are two things which are very important to make this Janata Curfew a success. One is the enforcement, and other is the participation of the people at large. Now that is something we'll get to know in a day or two. At this point we know that it is a big hit for traders who are forced to put their shutters down on their shops, because they have been moving from a lockdown to another, yet to recover from the previous lockdown, but they have to endure this one as well. What is important at this point is that whether Mumbai does cooperate, Mumbai and Maharashtra on the whole does cooperate with this Janata Curfew to ensure that their fight against Corona comes out and they come out victorious with minimum casualty. That is critical at this point, and that's why these guidelines have been put in place.
All right, Mayor, we're going to leave it at that. Mihir Trivedi, Zabawarsi, thanks for joining us from two different locations in Mumbai. Clearly, there has to be better enforcement. There has to be, if this has to work, and this, in the words of the Chief Minister yesterday, is a last resort. If this has to work, there has to be better enforcement than what we're seeing right now in Mumbai. Let's bring in our guest, Sanju Verma, BJP National Spokesperson, Shama Mohammed, Spokesperson of the Congress Party, Anurag Katriyar is President of the National Restaurant Association of India, Dr. Tripti Gilada from the Messina Hospital, and we're also joined by Gurbash Singh from the Federation of Hotel and Restaurant Association of India. Let me start with Shama Mohammed. You heard both our reporters there. There seems to be very lax enforcement of this Janata Curfew. I mean, if the whole point of this curfew is to break the chain, then clearly there is no enforcement of it on the ground in a bid to try and break the chain. People are going about their normal business from the looks of it.
The Janata Curfew has just started. It started tonight at 8 p.m. So it's just the first day. But what you have to understand is the Maharashtra government has taken a step like this called a Janata Curfew because the cases have gone up. Maharashtra government has always been transparent with the number of cases and with the testing and all that. But what I see out here is when we had vaccination at our doorstep, it was exported, and Maharashtra government had no other choice, rather than sending those vaccinations to hotspots in India to where it was really required, it was exported by the Prime Minister of India. So we did not get the vaccination at the right time. So one had to take these steps. Let's not forget there is a package also. Along with this, the Maharashtra government has put in 5,476 crore package in which your construction workers who are registered, 12 lakh of them will get 1,500 rupees per month. Auto rickshaw drivers, 12 lakh auto rickshaw drivers who are registered get 1,500 rupees. People from families from the tribal area
we know all of that. That may well be the case. That may well be the case. We heard the Chief Minister outline all of that yesterday. My point is simple. That was yesterday. Today on day one, when everybody knows 8 p.m. onwards the Janata Curfew will start, people are going about their business as though it's normal. So what's the point?
I know. It's not. No, it's not normal. I'm in Pune right now, all right? And I can, from my window, I can see outside. It's completely quiet. There's nobody out there. Now, she must be at a certain point. Now, why don't you do a story today? Let me ask you, why don't you do a story today in why the Gujarat High Court has filed a suo motu PIL, and said that there is the exact PIL says
Shama, we have done the story of the Gujarat High Court. We've done stories about ambulances going for 2-3 kilometers outside hospitals in Ahmedabad. We've done stories about people standing for 5-6 kilometers for remdesivir in Ahmedabad. So I don't know what you're talking about. No, one second. The point, you understand what I'm trying to say. This is not a Maharashtra versus Gujarat problem. This is a problem for all of India. So let me get Sanju Verma in. Sanju Verma, the point that Shama Mohammed is making, is that the Maharashtra government was left with no choice but to impose a lockdown because of the sheer number of cases and because of the fact that you're giving them limited vaccine supply.
Zakka, I will rebut the lies by the Congress spokesperson with bare data and statistics. Point number one, for the last 7 to 8 months in a row, Maharashtra has been consistently at number one in terms of the highest number of absolute COVID deaths. Even today, 34% of the total deaths in India come from Maharashtra. Point number two, in the last 3 months, Maharashtra along with Kerala and Chhattisgarh accounts for 72% of India's active caseload. Point number three, the Congress spokesperson obviously doesn't understand data or chooses not to. The fact of the matter is that Maharashtra's case fatality rate, CFR, is almost double that of India. The Modi government has done a brilliant job, and that is vindicated by the fact that despite limited resources, our case fatality rate is just 1.2%. The lowest in the world.
But Sanju Verma, look at what is happening across the country. Please look at what is happening. Please look at what is happening across the country. There are queues of ambulances outside hospitals in Gujarat. There are queues of people standing for remdesivir across the country. There are some 35 lakh people at the Kumbh Mela. What are you talking about this great job? What are you talking about this great job that's been done? We are in the middle of a second wave. Today, Delhi has 17,000 cases. There are 35 lakh people standing for the Kumbh Mela and taking the Snan. There are queues and queues of ambulances outside the two major hospitals in Ahmedabad. There are 5-6 kilometer long queues of people waiting for remdesivir. What is this great job you're talking about? We are back to square one. We are today in a worse off position in 2021 April than we were in April 2020. Let's get real, folks. Let's get absolutely real about the situation in India right now. And this is not a Gujarat versus Maharashtra problem. This is not a BJP versus Congress problem. This is our problem. Our people will die if we don't do something about it now. 17,000 cases in Delhi. Can you imagine that? Can you wrap your head around that? 17,000 cases in Delhi, ladies and gentlemen.
Can I please come in?
No, I want to get in. I want to get in the others as well. Mr. Katriyar is joining us. Okay, let me go to Dr. Gilada first, please. For God's sake, let's listen to the doctors. Let's listen to the doctors. Dr. Gilada is consultant physician with the Masina Hospital. Dr. Gilada, please tell us. I beg with folded hands to everybody else on the panel to please listen to the doctor. Please tell us what is the situation you are facing on a daily basis, because you guys are at the forefront. You have been dealing with this, oftentimes sacrificing your families, your normal lives. You've been literally at a war for the last 1 year. Please tell us what is the situation right now in your hospital.
So the first thing I would like to speak for every doctor is that we are absolutely disgusted with the way we are just fighting against each other. We need to understand that it's Maharashtra today, it will be all the other states later on. So we cannot fight with each other. We really need to fight with the virus. And the blame game is absolutely not working. We are in a disastrous situation. The ICUs are full. Every hospital has a wait list of 60, 70, or almost sometimes even 200 patients. We are desperately trying to arrange for oxygen cylinders at home. We have patients queued up. It's absolutely frustrating because this is something that we really did not want to see 1 year later. Yeah. We thought we had done with the first wave and people will behave responsibly. And here we are back again in an even worse situation. So I think we should just stop fighting about the vaccines and everything. We need to just make a game plan to get out of this mess together.
Okay, let me go to Mr. Katriyar and to Mr. Kohli. Mr. Katriyar, I know there is pain. There is tremendous amount of pain, particularly in the restaurant industry. But when you hear stories, not just of what Dr. Gilada just said, but there are numerous stories. I'm sure you've heard of either friends or friends of friends who are all looking for hospital beds or oxygenated beds and so on and so forth. Shouldn't we, at least as a nation, come together, whatever it takes, 2 weeks, 3 weeks, 5 weeks, to put an end to this, and then we can get back to some degree of normalcy in our lives? Mr. Katriyar.
Yeah, Zakka, you're absolutely right. First of all, let me begin by thanking Dr. Gilada and everybody in the medical fraternity for the service they are lending to the nation. And I sincerely urge that we should stop looking at this problem from a political prism. I think it is very disgusting to see this political slugfest over something which is a huge human problem. I agree, we all have to fight it together. We are partners to the government and the administration in this fight against the pandemic. But unfortunately, I can't not think about what could have happened and what happened. Things have worsened to a state where today I cannot say that we should allow the businesses to commence. But at the same time, if we don't look at it as an administrative and a health problem of a great magnitude, then we are not solving anything.
Yeah.
What Maharashtra is witnessing today is lockdown. I mean, we can give it any other name, but this is a lockdown. All I want to tell the government is please enforce it with your with the best power at your command, and whatever you are allowing to operate, give very clear instructions.
Yeah.
And I say that specifically for our industry. When you say home delivery is allowed of food, then you should not have cops beating up our people at 8 p.m. saying that it's time to pack up when the order says 24/7.
True.
So I think, we all are partners to it, but treat us like partners and not pariahs.
Okay.
We are with you. We are, as citizens of this country, we are with the
No,
government.
I agree with Mr. Katriyar. You know, the worst thing that can happen is after 15 days of lockdown or Janata Curfew, call it what you want, the nomenclature doesn't matter. But after 15 days, if the case load has not come down in a substantial way, if we have not been able to break the chain, then God forbid we'll have to do this for, another 15 days and another month. Who knows? Mr. Kohli, I do want to know from you, what is it that you can do in a creative fashion? Let's look for solutions. Is there something that you can do? Yes, you're going through tremendous pain, but is there something you can do to try and mitigate some of that pain, yet at the same time, let's be absolutely be on the same page on this. The number one priority is this disease. We have to overcome this disease.
No, absolutely. I absolutely agree with this. And we also understand the seriousness of the issue and the limitations the government is facing in the war against this pandemic.
Yes.
We need to look at this as a socio-economic problem. It's very difficult to balance, keep a very fair balance. But we need to see now that the cure cannot be is not worse than the disease itself. Any kind of knee-jerk reaction, any kind of direct not thought about or not involving any stakeholder, if any action is taken, it is usually at a detriment. And while we will keep on arguing about lives versus livelihood, I think you can't treat them separately. You have to take both of them together. So we have been with the government. Our industry has been with the government. We're standing with the government. You know what we did last in the first 0.110 or whatever you want to call it, and we are carrying on doing it. I just want to say that don't treat us as a super spreader. We are not. There are a whole lot of rules and regulations given. We are following them. The MHA has given us, the local governments give us, the local bodies give us, and the FSCCI gives us. We are following those, and I don't think we are contributing in any way. Okay. Yes, if there is anything that the government would like, in some states, like in Maharashtra, we are working very closely with the government, and to ensure that this pandemic is just driven out.
Is conquered. I mean, that's the only way. We need to defeat this disease first.
There is no room for even...
Let me go back to Shama Mohammed and to Sanju Verma. Shama Mohammed, let's have some bare rules here. Let's have some bottom line here. This is a disease that's affecting all of us, irrespective of political affiliations, irrespective of whatever other affiliations. Can you give us some kind of assurance? Maharashtra is going through hell right now, 15 days. Mr. Kohli and Mr. Katriyar are right. I mean, literally the back of their industry is being broken. But can we have some modicum of assurance that by the end of that 15 days, we would have had some grip on this disease? That Maharashtra would have at least had some grip on these rising cases? Today, Bombay had almost 10,000 cases.
Okay, so there are 11,000 cases today in Karnataka, but I don't want to play politics.
Oh, man.
The lady who said, no, I don't want to play, but I'm just going to tell you, you have to listen to my part.
Yeah,
now,
please.
When the central government wants to compare cases and the number of cases and number of deaths, they compare to the Western countries. But when Western countries did the lockdown, they gave a huge amount of money to this hospitality sector. That's very important, to give some sort of support to the hospitality hospitality sector, since they form 7% of our GDP, but nothing is given to them by the central government. Now, Sanju Verma kept saying about the number of cases in Maharashtra. That is because of the transparency, Sanju Verma, of the Maharashtra government in testing. Let me just give you one example. 8 April, 41.
Can I please?
I will come to you. I will come to you. Let her finish, please. I will come to you, Sanju Verma. I will come to you. Let her finish, though. I will come to you, please. Will you give her 30 seconds?
Yeah, 8 April, 41 bodies cremated in Madhya Pradesh. All right. But the official report says 27 deaths. 10 April, 56 bodies cremated. Official government report says 24 deaths. 11th April, 68 bodies cremated. Official
Shama, again, I would have completely appreciated had you said, this is a problem that we need to deal with war footing. Again, you're going back into Madhya Pradesh versus Maharashtra. How does it matter? How does it matter? People are dying in Madhya Pradesh and people are dying in Maharashtra. I'm so absolutely disappointed at this political slugfest. Sanju Verma, will you at least please not politicize it? I mean, let's get a reality check. Across this country, Congress governments and BJP governments have messed up the handling of COVID. That's the simple truth of it. That's the home truth. It's hitting us now. Sanju Verma. Sanju Verma. Yes, Sanju Verma, yes.
Why are you not stopping her?
Why
are you not stopping her?
I can't physically go and stop her. No, I'm sitting in Delhi. She's sitting in Pune. At best, I can put the fader down. Go ahead. Go ahead. I'm listening to you and only you. Go ahead.
Yeah, thank you. Thank you for being so gracious. Let me now tell you, first of all, I would like to thank the doctors on your panel. I think the doctor fraternity has done a stupendous job. And I'm sure they feel that politicians on your panel are indulging in a slugfest. I'm sorry if you feel so, sirs and madams, but I would just like to say one thing, Zakka, I beg to disagree with you. You say, what is so great about Modi government's handling of COVID? Let me tell you that the international medical fraternity, people like Antonio Guterres of the United Nations has said that India has today the biggest assets in terms of COVID manufacturing capabilities with respect to the vaccination drive. Our vaccination drive is the fastest. We have vaccinated more than 11.2 crore people, just next only to US and China. Please understand, Zakka, you have been talking about Kumbh. Is it selective amnesia? You did not mention about Ramadan. And let me tell you, it is not election-bound states.
All public events. Ban all public events.
No.
Ban all public events.
Elections, no.
Ban election rallies, ban Kumbh, ban Ramadan public events, ban all public events.
Because of shoddy governance. It's shoddy governance, not lack of vaccines. It's not a supply side issue.
Are there no cases? Are there no cases in Gujarat, in Karnataka, in Madhya Pradesh? Come on, what are you saying? This is why the ordinary person in the country right now is so frustrated because of this Congress BJP tutu meme for even a public health emergency. Sorry, I'm cutting short the debate. I'm really disappointed today. I'm cutting short the debate. I am really so disappointed, and I'm once again begging with folded hands. Please come out. Please come out. I'm begging with folded hands. If people in authority are watching this, I'm begging you with folded hands. This is not a Gujarat versus Maharashtra problem. This is not a Congress versus BJP problem. This is a you and I problem. Our people are dying, whether they are in Delhi, Mumbai, Chennai, Kolkata, I don't care. Our people are dying because of lack of oxygen supply. They are dying because of lack of proper medication like remdesivir. They are dying because beds are not available. We cannot afford to be like ostriches with our heads buried in the sand. Not now. The second wave is here. This is the home truth. It is hitting us now. Like I said at the top of the show, Delhi has clocked 17,000 cases, ladies and gentlemen. Just take a moment for that figure to sink in. 17,000. And at a positivity rate of 16%, that means a few thousand are positive out of that 17,000 already on one single day. 50,000 people are in hospital, in different hospitals in Delhi right now. And if we still think this is a political partisan problem, then I'm sorry. I'm sorry. I don't think anybody can save us. I'm sorry to end this broadcast on such a disappointing and rather difficult note, but I hope this is a wake-up call. I really, really hope that this is a wake-up call, and those in authority, irrespective of, political party, irrespective of central government or state governments, those in authority come forth together in unison and deal with this second wave. Otherwise, this second wave is going to consume us. Thank you for your time. I'll catch you again tomorrow night.